Good afternoon and welcome to the Madison VA Hospital's live telephone town hall. Our leadership team is excited to hold this teletown hall with women veterans who use the Madison VA or any of our 6 community-based outpatient clinics in Baraboo, Beaver Dam, Janesville, and Madison, Wisconsin, as well as Freeport and Rockford, Illinois. I encourage you to stay on the line with us and participate. This gives you an opportunity to speak live with us and ask questions about your VA healthcare. My name is Tammy Town. I am the Facility Women Veterans Program Manager, and I'll be moderating this afternoon's call. Thank you for taking the time to join us. A panel of Madison VA's leadership team is here to provide information and answer your questions. This includes our Acting Hospital Director, Ms. Alicia Miller, Deputy Chief of Staff, Dr. Chris Hildebrand, Women's Health Medical Director and Residency Attending Provider, Dr. Maddie Alvarez, Health Benefit Services Supervisor Judy Green, Mental Health Specialist Sarah Frazier, Community Care MSA Supervisor Tara Eastlick, Suicide Prevention Program Supervisor Andrea Bailey, Whole Health Program Manager Sarah Rogers, Health Promotion and Disease Prevention Program Manager Karen Balke, LGBTQ+ Veterans Care Coordinator Margot Edge, and Patient Advocate Cheryl Scott. We hope this teletown hall provides a more convenient way for you to speak with Madison VA leaders and get answers to your questions. We are able to reach more women veterans so we can ensure we hear your voice and focus on what's important to you. Please note, for the next hour, we will provide information on the VA Women's Health Reengagement Training, also called HEART, LGBTQ+ Awareness, the Service Act, Health Promotion and Disease Prevention, Suicide Prevention, our new female gynecologist, and infertility benefits. And then we'll have a live question and answer session. If you would like to ask a question, just press 0 on your phone, and you will be connected with a staff screener who will take your question and get you into queue to speak with our panel. We'd like to address as many of your questions as possible during this call, so we have to limit participants to only 1 question each. If you do get on air, please remember that other veterans are in line to ask questions, so keep your questions brief, and please do not share your personal health information in this public forum. If we are not able to answer your questions on air, we will make sure to follow up with an answer to your specific concern. We want to make sure all questions received are answered. If we don't make it to your question by the end of the call, be sure to stay on the line, and you'll have the opportunity to leave us a voicemail so someone can get back to you. I'd like to welcome our Acting Facility Director, Ms. Alicia Miller. She comes with several years of experience and has been with the VHA since 2004. I'm going to turn over the call to Ms. Miller for opening comments.
Well, good afternoon. 2004. Wow, that's a long time ago. That just dawned on me. We are thrilled to have you guys here with us this afternoon and joining us to participate in our teletown hall. I'm excited to be here as the Acting Facility Medical Center Director. My prior role, prior to coming here, was the Associate Medical Center Director at the Robert J. Dole VA Medical Center in Wichita, Kansas, where I started in May of 2022. I have several years of experience in leadership and program management throughout the VA. I plan to continue to enhance programs and services, promote patient safety, and deliver the best care through our Madison VA hospital and clinic. I'd first like to update you with some significant changes that have occurred in the past couple of months. Our Chief of Staff, Dr. Alan Bridges, and our Facility Director, John Royer, have retired. Dr. Bridges, with a career that expanded over 36 years, providing care to our veterans and leadership to our clinical staff. John Royer served the VA for 37 years and advocated for veterans and staff to make our Madison VA one of the best in the nation. Both of their efforts have helped grow the Women's Health Program to provide many services in primary care, specialty care, mental health, and wellness. We wish them all the best in their retirement. It is also my pleasure to announce our new Chief of Staff, Dr. Ryan Marsh. Dr. Marsh has been on the staff at the Madison VA since 2002. He has worked in several critical areas, including primary care, inpatient. He was an inpatient hospitalist, environmental health, and compensation and pension. Dr. Marsh attended medical school and his residency at the University of Colorado. We are happy to have him as our new Chief of Staff. I look forward to your questions in a little while, and thank you for your participation.
Thank you, Ms. Miller. Our first update is on the VA Women's Health Reengagement Training, also called VA Women's Heart. Maggie Banks will provide us with an update on the VA Women's Health Reengagement Training.
Thank you for your introduction, and thank you for having me this evening. And I want to thank every one of you for your service to our country. As stated, my name is Maggie Banks. I am a program manager for the VA Women's Health Reengagement Training. I am a veteran of the Army Reserves. I was on active duty twice to support multiple campaigns, and I also actively use VA healthcare. These experiences have driven me to find ways to support my fellow women veterans and support to offer this program to women nationwide. We're excited to share our program with you. The VA Women's Health Reengagement Training, also called HEART, is an official program offered through the Office of Women's Health through the VHA. We hope that you'll join us in a session that we have to offer to learn more about the benefits that you have earned by your services. So what I would like to talk to you about is why the program was created. Women veterans are the fastest growing population of veterans right now. And by 2026, it is projected that there will be 2.2 million women serving in the military. Women are underutilizing VA healthcare benefits compared to their male counterparts by about 8%. We've learned that some women do not identify as veterans and do not self-disclose because they may not have gone to combat. This training is for all women veterans who served regardless of time or duty assignment. Women have some significant adverse health effects, including higher risk of chronic pain, higher depression rates, or cardiovascular disease. And some women don't feel comfortable walking into a VA. The wonderful part of all of this is that VA has taken many strides to improve our experiences and has emphasized educating all staff that women belong and are welcome at VA. The VA Office of Women's Health Reengagement Training aims to connect and educate our women veterans all across the country, not just those who are currently unenrolled, but also those who are enrolled, but are unaware of all the services that VA provides. So this year, we have offered 50 training sessions, 40 virtual and 5 in person. We have 2 virtual sessions left in our season, and we have 2 in-person sessions left in our season. So the training was designed with women veterans at the center. We consulted with VA subject matter experts to ensure we are providing the most current and up-to-date information. You can either attend virtually or in person. The training is delivered by 100% women veterans in 4 consecutive phases. 1, VA Women and VA Women's Healthcare. And this section is an opportunity for the women to connect with each other and the trainers, and an introduction to course materials itself. Phase 2 is Understanding VA. This phase breaks down Big VA, and we introduce our guest WVPM, or Women Veteran Program Manager, to discuss the role and how they support women veterans within the healthcare facilities. We also discuss in this section that there are 3 main components that make up Big VA. We talk about the models of the different healthcare facilities that you may experience in your area. In phase 3, we cover all the healthcare services women veterans will actually have access to when going to VA. This is the majority of where the material is focused and covered. We cover everything from A to Z. And then lastly, we cover the enrollment in VA healthcare and tactical actions to enroll. And if you're already enrolled, we also discuss necessary resources to gain support on your healthcare journeys. The VA services that are offered are vast, and we will cover in our training the VA healthcare services, which includes primary care, general health, wellness, and screening, specialty care like chronic conditions, heart disease, diabetes, and pain management, mental health medications, counseling, referrals for anyone who experiences military sexual trauma, And then lastly, staying healthy with cutting edge care that supports your continued health and well-being. Our training also covers the most current policy updates as they become available through VA. So the newest policies that we include during our training sessions is reproductive care access. And this is when the life of a mother is endangered or a pregnancy is a result of rape or incest. We also discussed the VA expansion of maternity care coordinators. VA is extending the support to 12 months after birth, and you will be assigned a maternity care coordinator to support you through your joyous event. And lastly, we covered the PACT Act and the Compact Act. I'm heard that we're covering those topics later, so I'll let the continued speakers cover those in just a few moments. What our women gain from attending our course is a comprehensive knowledge of what woman-specific services are offered by VA, the steps needed to enroll and navigate VA healthcare, and tailored learning experience and information specific to women's needs. Finally, and most importantly, it's a safe space to share your experiences and build community with your fellow women veterans. I would like to share just a few of the many responses we have heard after attending our training sessions. First, the best, most clear, straightforward explanation of VA benefits and resources ever. 2, instructors were engaging. The instructions were geared for me, a woman veteran, just perfect. One of my most moving comments and one of my favorites is I did not know military sexual trauma or intimate partner violence counseling was available to me even after time had passed. I was in tears of relief to learn there really was help. Lastly, thank you for changing my 26-year outlook on VA in 4 hours. All these comments were taken from our surveys. We review all the comments, allowing us to continuously make improvements for our participants, taking the suggestions into account. As I mentioned earlier, we offered 40 virtual sessions and 5 of them in person, but we are at the tail end of this season, we will be offering 50 more virtual sessions, or 50 trainings next year. 40 of them virtual again, and then 5 to 10 in person. So let's talk about how you can access our information. Let's talk about how you can actually sign up for one of our upcoming training sessions. You can visit our website, and that website link is www.womenwithans.heart.info. I'm going to spell that again. It's www.wom as in Mike, E, N as in Nancy, S as in Sierra, HEART, like as in Tom, .info. Our website, you will learn about more about our program, access to national and local resources that we have partnered with, and you can download the training materials needed to attend our training session. You will not need to review the training materials prior to the training itself. We will cover it all with you during the session. We certainly hope that we will see you in an event shortly, and I will now turn it back over to Tammy. And thank you again for your time, and look forward to seeing you soon.
Thank you, Maggie. Such a great program. You may have noticed quite a bit of construction occurring behind our main building along University Ave parking lot. We are adding an employee parking garage. Construction for the employee parking garage started on May 15th with an anticipated completion date around June of 2024. Visitors and veterans should not be impacted. You can still park in floors 1 through 3 of our parking ramp. The next update we have is from Margot Edge on LGBTQ+ awareness.
Hello, my name is Margot Edge. I'm the LGBTQ+ Veterans Care Coordinator. The LGBTQ+ Health Program wishes all the LGBTQ+ folks a happy Pride Month. On June 1st, we raise the pride flag on the main hospital campus, and you will see pride lights at the medical center as well as the Rockford Clinic. We have been working hard to develop a great array of events for veterans and caregivers, as well as educational sessions for staff. If you missed us at the Rockford Pride Kickoff Party last weekend, we will also be out in Madison at the Juneteenth Festival in Penn Park on Saturday, June 17th, and in Janesville at the LGBTQ plus Education Summit at Black Hawk Technical College on June 22nd, which is an all-day event. On Monday, June 12th, from 9 a.m. to 1 p.m., we will have an informational table in the lobby of the main hospital and at the Rockford Clinic on Friday, June 30th, from 9 to 1. The LGBTQ plus health program is working on many projects to improve and expand services for LGBTQ plus veterans. Recently, we established the Madison VA Hospitals and Clinics LGBTQ plus Veterans Gov Delivery email group, where you can receive up-to-date information on the LGBTQ plus health program, VA services, as well as community and VA events. We also created a new My Healthy Vet triage group for active patients as another way for you to communicate with us. The group is MAD LGBTQ plus, spelled out PLUS, with the @ symbol. Again, that's MAD LGBTQ PLUS @ symbol. Speaking of services, we have launched a virtual Pride and Inclusive Health Promotion Group. Topics include identity continuum, VA military culture, relationships, family, and community resources. If you are interested in learning more about this group or other services, you can ask your provider for a referral or contact me, your LGBTQ plus Veterans Care Coordinator, at 608-256-1901, extension 10762. That phone number, one more time, is 608-256-1901, extension 10762.
Thank you, Marco. Our next update is on the Service Act. The Dr. Kate Hendricks Thomas Service Act was signed into law on June 7, 2022, and is named to honor Dr. Kate Hendricks Thomas, a Marine veteran and public health professional. The Service Act stands for Supporting Expanded Review for Veterans in Combat Environments. This act allows veterans who served in certain combat locations and periods to receive services to check the risk for breast cancer and get a screening mammogram if needed. This means that women under 40 years old are eligible for a breast cancer risk assessment to determine their cancer risk based on family history and toxic exposures. It is not recommended to have screening mammograms for patients under 30 if toxic exposure is the only risk. You will be contacted in the next few months for an assessment if you are 39 years old or under. If you do not receive a call and would like an assessment, please let me know and I can connect you with the group doing the assessment. I can be reached at 608-256-1901, extension 10907. Again, that is 608-256-1901, extension 10907. As a reminder, if you are 40 years old and older, we follow the American Cancer Society guidelines and provide mammogram screening according to those guidelines. For those with average risk of breast cancer, screening is generally once a year for women 45 to 55 years old, and 1 or 2 years for women 55 years and older. Also, if you have any breast changes or concerns, be sure to contact your primary care provider, as a diagnostic mammogram can be ordered if needed or indicated at any age. Our next update is from Karen Balke, our Health Promotion and Disease Prevention Program Manager.
Thank you, Tammy. Our focus in primary care is health promotion and disease prevention. That means we work with you to maintain or regain your best level of health. We provide vaccines, screening tests like stool cards and CAP exams, as well as checking in with you regarding your health habits related to alcohol, tobacco, and physical activity. We're also here to help you if you have any other concerns about your mental health. Your primary care team is here to support the whole you, mind, body, and spirit.
Thank you, Karen. We have some exciting events coming up in June for Women's Veterans Day. Women's Veterans Day is June 12th. We'll be having celebrations, including a health fair and activities at our main hospital in the lobby area on June 12th from 9 a.m. to 1 p.m. We also will have events at each CBOX the first and second week of June, all being from 11 a.m. to 1 p.m. We will be at Baraboo CBOC on June 7th, Rockford CVOC on June 8th, Madison West Clinic on June 9th, the Main Hospital on June 12th, Janesville CVOC on June 13th, Beaver Dam CVOC on June 14th, Freeport CVOC on June 15th. We look forward to seeing you. To view the dates and times, you can go to our Madison VA website at www.va.gov/Madison-Health-Care and scroll down to the event section. The details will be listed under the topic of Women Veterans Day. Again, the website is www.va.gov/Madison-Health-Care. Next, we want to take this opportunity to learn more from all of you. We have a couple voting questions for you. The first question is, what day of the week works best for you to participate in a focus or support group or other types of events? For Monday, press 1. For Tuesday, press 2. For Wednesday, press 3. For Thursday, press 4. For Friday, press 5. Again, the question is, what day of the week works best for you to participate in any focus group or other type of event? To respond, please press 1 through 7 on your phone. For Monday, press 1. For Tuesday, press 2. For Wednesday, press 3. For Thursday, press 4. And for Friday, press 5. Looking at the results right now, they're all really close in number, in percentage, I should say. So Monday we have at 19%, Tuesday at 23%, Wednesday at 22%, Thursday at 14%, and Friday at 22%. So sounds like you're all very busy. But thank you very much for the responses. They'll be very helpful in helping us plan for some of our events. We have a few more updates on suicide prevention, as well as our new female gynecologist and infertility benefits. However, let's take a few questions to ask your questions. Remember, press 0 to speak to an operator to ask a question. Hi, we have Marie on the line. Marie, Carol Marie, sorry. Carol Marie, what question do you have for us? Again, that's Carol Marie Guglielmetti. Hope I said your last name right.
Sorry, I have you on mute. I started talking and I was talking to no one. Yeah, I'm a 25-year cancer survivor, and I have a lot of issues with long-term effects from the actual treatment from the cancer, the chemo and radiation. One being heart disease. I had a triple bypass 10 years ago. And it's not any better out in the community, I will say, but I would love to be a champion for the VA to explain to people that once you've survived from cancer, unfortunately, it's not done, and you have a lot of issues and a lot of different type of follow-up that you need to do. And it's been very difficult to navigate my health care through the VA, through the community, to get the proper follow-up I should be getting. And I don't know if I'm missing some type of services or some type of community coordinator that could help me better, but that's my long question.
This is Dr. Hildebrand. You've been through an awful lot, and you should be to deal with the ramifications of cancer after you've survived it and beaten it is really difficult. The number of possible medical conditions that can be associated with chemotherapy and radiation therapy is long. And so my question is, have we talked about all those possibilities with your primary care provider, who really ought to be the initial coordinator of your care?
Yeah, unfortunately, I end up having to do the research on my own to prove to them, and I'm not blaming them because, like I said, it's the same out in the community. I'll give you an example. So first of all, my cancer was Hodgkin's lymphoma. I took a lot of radiation to the chest for that. So I'm 58 years old now, and the protocol for me is to be getting a breast MRI and a mammogram every year. I switch it off every 6 months because I'm at higher risk for breast cancer for obvious reasons. I get that care now through the VA, but I had to prove it. I couldn't just say, hey, look, they didn't know, is what I'm saying. And so every single thing that I have to do is a struggle, and I have to find it out on my own. There is no protocol that says, oh, you had radiation to the chest, so you should be getting this, and you should be getting that, and oh, you had a triple bypass. I'll give you another example. I've never seen a cardiologist at Madison VA. They have me see a physician assistant all the time, and I don't think that's right, but they tell me they're too busy. So,
I'm gonna take you up on that one. Now the PAs are all actually overseen by cardiologists. And I think if you're here next time and you want to talk to the cardiologist in person, ask that. If they refuse, go to patient advocate, because you should have that say. But the physician assistants are not independently performing cardiology care. Just to be clear on. Okay. So I'm glad you're seeing the cardiologist group. Regardless, I think my guess is they're giving you sound advice. And I think if it comes down just to wanting to see the face of the cardiologist, you should ask, and they should accommodate you.
Okay.
And regarding the other, you may want to ask your primary care to put a consult in to see the oncology group as a follow-up, ongoing post-cancer care as an option. That's not something that most primary care people would necessarily think about off the top of their head, but that's something you could certainly ask for.
Yeah, and I stopped seeing my oncologist out in the community years ago because it was the same response. They said, oh, it's been years since you had treatment. This shouldn't affect you now. But when I say nobody knows, nobody knows.
No, you're right, and that's too bad. I agree with you. You're a very unique population, and you certainly should self-advocate. I agree with that completely, and I'm sorry that there isn't somebody here who can just tell you exactly what you need to do. Nonetheless, I think, a visit to oncology, not that you have to go back on a frequent basis, but somebody to help you understand what the next steps are.
Yeah. Well, I appreciate that. And at least I know that I'm not missing any services. I was pretty sure that, I'm, like you said, I'm my own best advocate, and I've been doing that. And so I'll keep moving along. But I'll take your suggestion on the oncology. I appreciate that, doctor.
Well, congratulations on the hard work you put in, and I'm glad you're doing well, it sounds like, in general.
Thank you. Yes.
All right, thank you. Next up we have is Deborah. Deborah from Michigan, are you on the line for us?
I am. Can you hear me?
Yes. What question do you have for us?
I actually already talked to somebody, but one of my questions was, and it may be a moot point at this point, but when I first reached out for help from the VA, I was told that because of the sexual assault that happened to me and the domestic violence, that I didn't have details of, like exact dates and people, that I couldn't apply for any disability, that they were providing counseling only. I have done that. I seek counseling. I've done everything I was supposed to do. But my question is, why isn't this considered a percentage of disability with the VA? Why is it only counseling so that we're all okay? I came in the early 90s, actually 1989, and there was very few women, and we were pretty much subject to whatever we walked into. So my question is this at this point considered a disability, or are we only allowed counseling for these problems? And I'm not the only one. I've talked to many women who have suffered through this, and they can't give dates or names. Some of them don't even know who assaulted them. And we don't have services for this other than counseling. We don't have any disability claims. And I'm wondering why that is, and if it's changed. It may have changed, and I don't know.
Hi, Deborah. My name is Sarah Fraser. I am a clinical social worker in the mental health clinic here, and I work a lot with women veterans, particularly women veterans who have experienced MST. And first of all, thank you for advocating for other veterans that have gone through this, and certainly sounds like you have done a lot of work on your own recovery.
Not only that, I'm a psychotherapist who's worked with other veterans. That's
amazing. Well, I'm glad you're bringing this up. And things have changed. So on our side of things, we definitely cover with VHA, with the health administration side of things, We do cover a lot of the specialty care that's involved in recovery from MST, particularly on the mental health side of things. However, there are changes when it comes to making claims, and that's processed through VBA, which is the Veterans Benefits Administration. So there's a couple things I would recommend, and this is to anyone, including you, Deborah, that's dealing with this. I would talk with your MST coordinator at your facility. I would also talk with your local service officer for your county about that process, because there are avenues for getting a disability claim percentage related to MST. And I really appreciate you bringing this up.
So this is a possibility. I actually just recently wrote a letter hoping to get this approved, but I don't know that it's even possible. And in the past, I have found it wasn't. So I appreciate that. I hope things have changed. We were 20% or less of the military, and we walked into a system where, in my case, the boss could have nude pictures of women on the computer, and the requirement was only that we asked them to take it down every time we walked into the office. There was so many things wrong in my day, and it's been many years since. And I do hope that this has changed since then.
Well, thank you, and thank you for bringing it up. So yes, MST coordinator, and then also talking with your county service officer about options. Thank you.
All right, thank you, Deborah. Next up, we have Karen Lee. Karen, are you there? Karen Rivers, we have a question from, oh, there you are. What question do you have for us today?
I'd like to know why female veterans are expected to accept gynecological treatment by our assigned VA general practitioner instead of an OBGYN doctor we've seen in the past, especially if we've had surgeries or previous issues.
Hi, Karen. This is Dr. Alvarez. Thank you for the question. So all of our clinics have women's health primary care providers who are trained to provide basic gynecological services, such as contraceptive counseling, screening for cervical cancer. And we do that to help, maintain continuity with your primary care provider and increase access, because our gynecology clinics are only available a couple of days a week. And also you don't have to travel to Madison for those services. Now, I understand that sometimes, as you mentioned, you may have had surgeries and maybe some more complex issues, but usually our primary care providers should be able to help triage, essentially, some of those services, and so that's why we usually have you go through them first.
Yeah, that's not acceptable. I would rather go to a trained gynecologist than somebody that prescribes your medication after checking your heart and you know what I mean? That's very basic care. Why put yourself through something twice?
Well, a lot of the times our primary care providers can provide treatments and things like that after basic, examination and getting a history from you. So.
No, my primary was a male who did not do that. And then I got referred to a female who I'd never met or seen before. And again, I prefer to see somebody I'm comfortable with who I've seen for years. So I just think that needs to be corrected. If we already have a provider, why go backwards to somebody else who knows nothing about us?
We have your concerns, and you can also always reach out to the patient advocate if you have any additional things to say.
Thank you. All right. Next up, we have Benny. Benny, are you on the line with us?
Yes, I am.
Right,
so my question is, and thank you for getting my name correct, but Benny is my preferred name, but I have yet to get a legal name change, and that is not my legal name that's in my records. I do appreciate that you do have a way to put preferred name in your system, but I have still had a lot of problems with getting dead named and stuff. And usually people, when I point it out, people are very apologetic and like, oh, I just didn't see it in the computer. But I'm wondering if anything's being done to either make that more prominent when somebody is pulling up someone's medical records, if they have a preferred name that is different than their legal name, or if there's any training being done for staff to make them more aware to look for a preferred name.
Yeah, Benny, that's a really great question. This is Margot, the LGBTQ+ Veterans Care Coordinator, and I'm sorry that's happened to you. So there's been a lot of recent, ongoing, and it'll be continuously ongoing training about gender-affirming language, including how to find the preferred name in the chart, which is pretty prominent. There's a lot of people that just don't know where to find it in the chart. So we want to educate our staff to be able to provide that information to help avoid dead naming and misgendering in the future. Again, I'm really sorry about that, but we have 4 trainings in the near future, all geared towards cultural competency in this area, including language training.
Thank you.
Great, thank you, Benny. So next we have a couple more updates for you. We have Andrea, our Suicide Prevention Program Supervisor, with a suicide prevention update.
Hello, as mentioned earlier on the call, women are the fastest growing veteran group, comprising about 9% of the U.S. veteran population. That number is expected to rise to 15% by 2035. VA is committed to improving the health and well-being of women veterans, including by addressing suicide risk and suicidal behaviors. If you or someone you know is struggling with thoughts of suicide, immediate support is available through the Veterans Crisis Line. Caring qualified Veteran Crisis Line responders are available 24/7, 365 to provide support for veterans at acute risk for suicide and for those calling on a veteran's behalf. To reach the crisis line, press 988 and then press 1, or text to the number 838-255, or you can chat online at veteranscrisisline.net/chat for assistance. Again, the phone number is 988 and then press 1 to reach the crisis line, or text to 838-255, or you can start an online chat at veteranscrisisline.net/chat.
Thank you, Andrea. So next up we have one more polling question. Our polling question is, what time period are you open to participate in focus groups or support groups or other types of events? For weekday mornings, press 1. For weekday afternoons, press 2. For weekday evenings, press 3. For weekend mornings, press 4. For weekend afternoons, press 5. Again, that question is, what time period are you open to participate in focus or support groups or other types of events? For weekday mornings, press 1. For weekday afternoons, press 2. For weekday evenings, press 3. For weekend mornings, press 4. For weekend afternoons, press 5. All right, so it looks like the most are available on weekday afternoons, 41%, followed by 34% on weekday evenings. Excellent, very helpful. So next I want to provide you an update about a new additional gynecologist we have on staff starting this month. Our new gynecologist's name is Dr. Amy Domeyer-Klensky. She will be available for appointments on the second and fourth Friday of each month. Dr. Domeyer-Klensky also works as a gynecologist at UW Health when she's not at the VA. As a reminder, gynecology services are only available through a consult from your primary care provider for services that they are not able to address. We also will still have our current gynecologist, Dr. Jeffrey Rodzak, available with no changes to his schedule. The last update we have is on infertility and IVF benefits. The VHA offers 2 types of infertility benefits, one of which all veterans are eligible for, the other of other offers advanced treatment and has a strict set of eligibility criteria. First, all veterans are eligible for infertility benefits as part of the medical benefits package under VA Directive 1332. The Madison VA does not offer these specialty services in particular, and so a referral to community care is needed. Overall, the process starts with the veteran talking with their primary care provider and expressing interest after they have been unable to conceive for greater than 6 months. The primary care provider can submit a community care infertility consult for the veteran. The consult will allow for veterans to go to an in-network fertility specialist. We also have a nurse care coordinator available to assist you along the way. The VA also offers in vitro fertilization or IVF benefits under VA Directive 1334. These benefits are only approved for veterans and their partners that meet strict eligibility criteria, one of which is legal marriage. There is a specific application and approval process for these benefits. IVF benefits include everything covered under the basic infertility benefits with an in-network provider, plus a set number of IVF attempts or completions, as well as cryopreservation and storage. If you are interested in learning more about VA infertility benefits, you can reach out to Madison VA's Infertility and IVF Care Coordination Nurse at 608-256-1901, extension 18584. Again, that phone number is 608-256-1901, extension 18584. All right, let's turn it back over to a few more questions. We have Lynn. Lynn from Wanakee. Are you available?
Yes, hi.
Excellent.
Can you still hear me? Okay,
yeah,
sorry. You cut in and out.
Oh, sorry.
That's okay. Okay, so you can hear me okay?
Yes.
Okay, so I have a question, but before I go on, I'd like to say that to the individual that requested to stay with a specific individual for like gynecological exams, there's no way that she could do that through community care, because I can appreciate like the sensitivity and what it's like, excuse me, and how uncomfortable it can be when those kind of exams happen with somebody you don't truly trust. Anyway, okay. Sorry about that. My question, I have to compose myself. My question, I had knee surgery on the 22nd of May, and when I go into the Blue Button report, do you know what I'm talking about when I say Blue Button report on My Healthy Vet?
Yes.
Okay, so when I go into the Blue Button report, and I did this in a couple different ways, I chose different dates to make sure that I was trying to encompass everything. So, but every time I ran the Blue Button report, I could never see the op report. And in certain sections, I guess it was a very short statement from the doctor that did the surgery. He said something about see op report. Well, when I run that report, or the Blue Button report, I cannot find the op report. So is the op report, I want to say, buried somewhere within My Healthy Vet? Or do I have to, when I spoke to the nurse, she said I'd have to go to the request an ROI. But it just seems kind of strange that I have to do a special request to get my op report, when to me, why isn't it just in the Blue Button report with all my other information? So basically, that's my question, if that makes sense.
Thank you for that, Lynn. This is Dr. Hildebrand again. So I, too, am a veteran, and I get my health care here, and I've had procedures done here, and guess what? I can't see my op report either. In fact, I can't see my own medical record. And these are rules the VA has. Now, be them good or bad, they are what they are. My Healthy Vet's great. I'm a big fan of it. I also happen to get care at the university, and they have their own MyChart over there. And guess what? I can't get my op report at the UW either. I don't know why. I think it has to do with the complexity of op reports. However, you are able to get that through the release of information. So is that a hassle for you? Yes. I am sorry for that hassle. But it seems to be the standard that these op reports are so complex and long that the only way to really get them is through the release of information. So I'm sorry, part of that package.
Okay, in the future for people going in surgery, is that maybe something that could be listed on just like add a couple sentences to their, when you leave, they give you, don't do this, don't do that, kind of, I don't know what that's called, but after surgery care kind of thing. Bottom line, could they say, if you'd like a copy of your op report, you have to request it through ROI? And that way you know it up front and you're not kind of waiting for it to show up in the blue button report. You know what I'm saying?
Great suggestion. Thank you for that. We can take that back to medical records and see where we go with that. Thank you.
I always figure it's one less phone call like this. So in the long run, it probably saves a lot of people a lot of time if you just add one or two sentences to a piece of paper. But
thank you.
Thank you. I
Thank you, Lynn. And I do wanted to mention one other thing too. So you had brought up again about gyne care or other types of public care or women's health exams. So if you do have a primary care provider, there are options to be with a designated women's health primary care provider, and they are able to provide more services because they are educated in women's health and that public exam care. So they can do more services prior to going to gyne, so you wouldn't have to necessarily move to different providers. You could all stay within your same provider that would be able to do all of that, the full scope of care. Now, if you do, you or you other veterans out there do have a need for assistance during these exams, you feel uncomfortable, you want someone to be there, we do have a sister program where a staff member or a volunteer is able to be with you during your visits or even public exams, whatever you wish. And you can reach out to the sister program through a phone number, and that's 1-888-478-8321, extension 13440. Again, that's 1-888-478-8321, extension 13440. And then you'll be prompted to leave a message, and then you leave a message with your name and your last four and a phone number to contact you at, and try to do that prior to 7 days before your appointment so that we can try to link you up with a sister. All right, so let's go back to some more questions. Next up we have Maureen from Marshall. Maureen, are you there?
Yeah. Yep.
Perfect.
Yeah.
What question?
I have a question about I am able to take a Tai Chi class in the community, and this person who is teaching it does work with veterans, and she said that because of the Mission Act, I can take a class with her. In fact, I'm looking at her consult thing now. Have had a little trouble taking it. I wrote all the stuff that she recommended that I write, and then, but they said that I could take it through the VA, but they didn't say it was okay to take it through the Mission Act in the community. So I just wondered, is that something that you are supportive of, taking it in the community through the Mission Act?
Hi, this is Sarah Rogers. I'm the program manager for Whole Health, and I want to thank you for asking this question and really highlighting these wellness opportunities within the VA right now. So let me talk about what we do have as offerings, and then maybe we can check out your particular situation a little more. So there are many Tai Chi virtual offerings. So that's VVC Veteran Video Connect offered throughout the week. We have Introduction to Tai Chi, Advanced Form, Adaptive Tai Chi. Additionally, we've got face-to-face in Madison, and I'm very hopeful by the end of the summer we'll have face-to-face in person in Rockford as well. And I'll just add, I know some veterans face barriers with online classes. There's a wonderful digital divide program here at the VA, which provides any veteran who doesn't have an internet-enabled device with a front-facing camera or an internet connection with a tablet to let them video visit. So that's the background about what we do have. For this particular class, because we have video offerings, we don't have a practice of paying community providers for classes. That said, the Whole Health model is really about empowering, connecting with your community. If you're in a position where this is the class you want to take and you're financially able to take that class, drawing on those resources is really part of the whole health model, which is building your idea of wellness and thriving. Does that answer your question sufficiently?
Yeah, it does.
Okay, thank you so much.
Yeah. Okay, thank you. Thank you.
Hi, Maureen. My name is Tara Eastlick. I'm the community care supervisor. And I wanted to let you know that if your Tai Chi instructor is interested in joining the community care network, they will need to reach out to the Optum network. I can also let you know, to be transparent, that joining the Optum network has some hoops and bounds and can take quite a time, but if they are interested in joining the Optum network, they need to contact them. Could you provide the information, and I could also reach out to them and provide them the direct phone number for Optum?
So at the end of the call, you're able to leave a voicemail. So if you could leave that information in a voicemail, we'll definitely connect with you and get back to you on that. All right, our next person up we have is Alice from Madison. Alice, are you there? Hi, Alice, are you there?
Yeah.
Excellent. What question do you have for us today?
Well, I had told somebody about what happened to us yesterday, that my husband and I are both veterans. We met in Vietnam, and he's 89 years old today. And yesterday he had an eye appointment, and we sat in the hallway at the hospital in the eye clinic for 4 hours before anybody took care of him. I think this is really not a good thing. And this happens in that clinic all the time. I have been there and have waited 5 hours and have had to leave without getting my eyes checked because I have to get back to where I live to have my dinner. And there's no rhyme, no reason. You get there for your appointment. They tell you your appointment's at 1 o'clock. You get there and there's already 15 people sitting there with the same appointment. And then they pick and choose who they're going to see. And I think that for making an 89-year-old man wait 4 hours sitting in a chair in the hallway is a little bit unreasonable.
Dr. Hildebrand, again, thank you for that feedback. I'm very sorry you had that experience. Eye clinic is a very complex beast. I can tell you that, and I can tell you too that it's not designed well, as you figured out. There are plans, and we're getting congressional support to build out a new eye clinic, and we suspect that's going to solve 50% of the problem. Eye clinics, by and large, I have an 81-year-old mother I take to an eye clinic outside the VA that we also wait a long time for. Some of that has to do with just how difficult these exams can be. It sounds like that was not the case for you, and I'm sorry that happened to you. So all I can say is the future should be better. There are a lot of providers that work in that clinic, and some of it has to do with the lack of rooms and specialized equipment that we need to expand upon, and we are planning to do so.
I don't know, because I have been there. I have been to other eye clinics at other VA hospitals, and I have never waited as long. And everybody around me is being taken, and I'm sitting there like I've got a hole in my head or something. I don't think it's I mean, I understand that everybody is busy and so on and so forth, okay? But I went for my eye clinic, for my eye exam. I'm diabetic, and I have to go every year. And I went to my regular doctor, and I got in. They examined my eyes, and I was out of there in 20 minutes. And I had a very good examination. There was no, if they're going to have all these people there, then each one should have a different appointment time to make everybody come in at the same time sounds a little illogical to me. I mean, I am a nurse, and it just doesn't seem, it somehow or other, it's just really ridiculous.
I understand completely. Thank you for that feedback.
All right. That's all the time we have for questions today. However, if we didn't get to your question, please stay on the line because in just a moment, you'll have a chance to leave a voicemail with your questions, comments, or feedback. Please note that we have recorded all questions, and we'll make sure that everyone who raised a question and has not received a response or needs follow-up will receive a response. We plan to get back to you with a response within the next several weeks. Thank you, everyone, for joining us, our telephone town hall. Have a great evening.